Hello dear colleagues, we would like to present you a report on the era of targeted therapy in the treatment of basal cell skin cancer, a clinical case of the use of vismodegib in the treatment of locally advanced basal cell skin cancer. Basal cell skin cancer is the most common tumor in humans. Also, basal cell cancer is predominantly characterized by slow, locally advanced growth and a low risk of distant metastasis. In some cases, it may be deeply invasive, such that excision of the tumor may not be possible or may result in a significant tissue defect. The recurrent cause of local advances basal cell cancer can make it impossible to use surgery and radiation therapy in treatment. Until recently, limited drug treatment options were available for patients with advanced basal cell cancer, but understanding of the molecular pathogenesis of this cancer has made it possible to create a new targeted therapeutic approach. We want to demonstrate the role of targeted therapy in the treatment of recurrent locally advanced basal cell skin cancer on the example of a clinical case. A key link in basal cell skin cancer carcinogenesis is abnormal signaling of the Hedgehog pathway, which is associated with mutations in PATH1 gene or the SMO gene. Hedgehog pathway inhibitors, which are targeted therapies for basal cell cancer, inhibit abnormal signaling in the Hedgehog pathway by inhibiting the small molecule. Such drugs are vismodegib and sonidegib. Vismodegib is approved by the FDA for the treatment of adults with local, advanced, and metastatic basal cell cancer that has recurrent following surgery, or those who are not candidates for surgery or radiotherapy. Sonidegib is approved only for the treatment of patients with locally advanced basal cell cancer. Sonidegib is not used in Russia. According to clinical studies, the objective response rate of vismodegib with local advanced basal cell cancer is from 40-60 to 60-80%. I present to you a clinical case of a 68-year-old female patient observed at the Novosibirsk General Oncology Dispensary with recurrent locally advanced basal cell skin cancer of the back, 3rd stage. Prior to contacting the dispensary, the patient underwent 3 sessions of photodynamic therapy. A complication of the underlying disease in the form of severe anemia was recorded, which required corrections of the condition. At the time of the clinical examination, dated January 2090, an ulcerative defect in the interscapular region with dimensions of 15 to 23 centimeters was determined. The patient was prescribed vismodegib at a standard dose for a long course until progression or intolerance toxicity. After several courses of therapy, treatment was interrupted. Progression of the disease was observed. After the resumption of therapy in the control study, the formation of granulations in the wound and a decrease in the size of the formation were noted. Thus, stabilization of the disease was not, and continued therapy with vismodegib was prescribed until progression or intolerable toxicity. Understanding the role of the Hedgehog pathway in the carcinogenesis of basal cell cancer and the creation of targeted drugs have given clinicians an important tool of the treatment of basal cell cancer in cases where it's impossible to achieve positive treatment results when using surgical and radiation methods of treatment. Thank you for listening.